Today, I am going to tell you guys something that no coaching institute tells or no faculty tells. Every faculty says that study my subject, it is very much important for NEET PG. But I have brought the marks weightage of past 5 years of NEET PG because 2020 से पहले and 2020 तक it used to be a 300 marks exam. The new pattern of NEET PG has been implemented from 2021. So let's see what is the marks weightage according to subjects, which subjects are the most important and which subjects you can revise by studying only the important previous year topics in case you are lacking time. So hello everyone, I am Dr. Mayukh Hazra, third year dermatology resident. Coming to the subjects, here is a tabular representation NEET PG 2021, 2022, 2023, 2024 shift 1. Why I have taken only the shift 1? Because shift 1 was like the new NEET PG pattern, shift 2 was something different. It was a disaster kind of question. That is not the actual pattern of NEET PG. So I am not considering it here because in shift 1 of NEET PG anatomy question 17 number of questions came, which is not the usual pattern. So I am considering only the shift 1. Then the NEET PG 2025, and we are also going to see the average so that we can understand how many questions in an average can come in NEET PG 2026 or further years of NEET PG. Coming to first subject, anatomy 2021, 7 questions came, then 5, then 8, then 7, approximately same. But 2025, slightly it increased to 10. The average number of questions is 8. Physiology, pretty low weightage, 5 questions, 6 questions, 9 questions, 5, 7 questions, 5 questions, then 6. Biochemistry is high weightage. So biochemistry 12 questions, 10, 15 in my NEET PG 2023, and biochemistry was my strong subject. So I was lucky to be in NEET PG 2023. 13 questions, 11 questions, the average is 12. Like this, pharmacology has reduced in NEET PG 2025. I think this is an outlier, but the average comes out to be 13 questions. Microbiology also, if you see the years, it is more or less constant. From this point, you can understand that NEET PG का question per subject more or less constant ही रहता है. So there is fair number of chances that the average number of questions that has been asked in the past 5 years, NEET PG 2026 में भी same ही repeat होगा. ये बहुत हाई चांसेस है क्योंकि तुम लोग स्टैट्स को देखो, लगभग सेम ही हो रहा है, एक दो को आउटलायर हो रहा है, जो कि आईएनआईसीटी में नहीं होता है. आईएनआईसीटी में सम ईयर दे गिव, इन आईएनआईसीटी में 2024 दे गिव many questions, 12 to 13 questions on I. Sometimes they give less questions on ComEd, sometimes they give more questions on ComEd. But NEET PG का marks weightage more or less same रहता है. This is a good point for NEET PG and all the aspirants. Coming to microbiology, C, more or less constant 11, 11, 13, 12, 13. So average is 12. Pathology also more or less constant, average is 14. I have highlighted because these are the most high weightage subjects which have more than 10 number of questions. These are coming. Community medicine is very high weightage in NEET PG. INICET mein it is not that much high weightage. INICET only focuses on biostats. But NEET PG questions are common sense based and some haywire questions are being asked in community medicine. This is the one subject that troubles the NEET PG aspirants a lot. FMT is also high weightage, 9 questions in average. Ophthalmology 7, like a short subject. ENT also 7. Medicine has very high weightage, 21. So if you are skipping medicine, then you are doing it wrong. If anyone is telling you that medicine is conglomeration of physiology, pathology and pharmacology, you need not to study medicine as a separate subject, then you are wrong. Do it from any rapid revision source which is more or less complete. Some questions will be out of the box, but questions like ABG, some questions related to hematology, some questions related to GIT, some questions related to infectious disease, these are going to remain constant. So if your notes has them, it is well and good, and annotate all the previous year topics in your notes. So don't skip medicine. It is my personal advice. I have seen people, those who have skipped medicine, and their result has been horrible. So never skip medicine. Surgery 22 questions, very high weightage. OBGY also limited notes, very high weightage, 21 questions. Pediatrics, why I have given red color? Because in last 2 years the weightage has decreased. See, 8 questions, 14 questions, 10 questions. Then in these 2 years, 2024 and 25, 6 questions and 7 questions. Maybe this is an outlier, or maybe in future the weightage of pediatrics can reduce. Average is 9 questions. Anesthesia 5, 2, 3, 4, 4. So it is a pretty low weightage subject, 4 questions. Dermatology average is 6, psychiatry average is 4. Radiology has increased a bit, so I have given it with the green color compared to the previous year. Its average is 4, 4 to 6 questions you get from radiology, and these are mostly integrated questions where you give the scan and the clinical features are also present. For orthopedics, it is 6. If you are finding this video useful, because like this kind of stats, no one else is going to bring you, no other coaching institute is going to bring you. So do subscribe to my channel, because you are going to get endless number of content related to NEET PG, statistical analysis, cutoffs, and how to prepare for NEET PG, FMGE and INICET. And if you want this PDF, do join my Telegram channel and WhatsApp channel. The link is given in the description box below. Okay, you can join it there. I will give the PDF. Now, if I draw a pie chart of pre and paraclinical subjects. So pre and paraclinical subject is the major chunk, 89 questions. Major subjects, the major four, that is the medicine, surgery, OBGY and pediatrics, they also constitute a major chunk, that is 73 questions, and the rest all minor subjects constitute 38 questions. Coming to the most important subjects. See, all the subjects are important. You should not skip any subject. If you are going to skip any subject, then you are doing a havoc mistake, because you can't attempt those questions. So if you are lacking time, what you can do is you can study the major important subjects and study a very quick and concise source for all the subjects which are not that much high yield or not that much high weightage, or you can study just the previous year topics. Now see, biochemistry, pharmacology, microbiology, pathology, community medicine, medicine, surgery, OBGY, these 8 subjects out of 19 subjects, these 8 subjects have 130 questions. That is 65% of the questions in your question paper are coming from only 8 subjects. And if you combine FMT and pediatrics, it is 148. That is 150 questions just from 10 subjects. So you have to focus more on these 10 subjects. You can read rapid revision notes and the previous year topics from the main notes. For these subjects, you have to be hyper focused and read every line with full concentration. Coming to high yield subjects, we have seen the high weightage subjects, but high yield means the amount of effort you give and the amount of output you get. That is high yield, means minimum amount, maximum output. So first subject I have kept is OBGY, because its marks weightage is 21, and from the limited notes only all the questions come. So you can easily make 20 corrects if you have studied your rapid revision notes of OBGY thoroughly. You can easily make 20 corrects. So this is the most high weightage subject. After that is biochemistry, mostly focused on the vitamins. Pathways are not that much important nowadays, so it is the second most high weightage and high yield subject. After that is FMT. FMT notes is this much, only 40 pages. If you study those 40 pages, you are going to make at least 7 to 8 correct of the 9 questions. Surgery also 22 questions, so a high weightage subject and mostly comes from notes. Pathology also mostly comes from notes, and these are high weightage subjects like pharmacology, microbiology. Pediatrics also you can cover in 2 to 3 days, and most of the questions come from notes. Dermatology, limited topics you can cover in 1 to 2 day, and all the questions come from notes. Though in NEET PG 2025, question came on nevus animicus and the best investigation for lupus vulgaris, it was a bit out of the box, but dermatology, more or less you get it from the notes only. And orthopedics also, if you study the instruments, if you study the braces, if you study the fractures, then it is more or less comes from the notes. It is more of ratification, I know, but if you study it well, most of the questions will come out from your notes. So I have a previous year list of all the three exams, that is INICET, FMG and NEET PG. So you can go for the combined list also or NEET PG alone list also. NEET PG alone list can give you 120 to 140 questions in common. But if you study the combined list, because many questions from FMG are coming in common in NEET PG. So if you go for the combined list, its strike rate becomes 140 to 170. You can use it for the subjects which are not that much high yield and you are not studying from revision source. You can use it for the subjects which are not that much high yield or which have not that much marks weightage. You study only the previous year topics. You can do that if you are lacking time. If you are having time, study the rapid revision notes of those subjects also. I will advise that. And image based questions are coming a lot nowadays. Approximately 25% of the questions are image based questions. So I have launched my digital image bank pro, which has 1850 plus high yield images, and the new questions which have come in the year 2025 NEET PG, INICET May, INICET November 2025 and FMG 2026. I have added those, and the best part is that the previous year questions are highlighted and marked as PYQs. So you can see that transient tachypnea of newborn recently came in the INICET November 2025. So I have marked it and it is highlighted with PYQ. So you can go for it. The link is given in the description box below and pinned comment section. Now you can see a video on how is INICET different from NEET PG and what should be the strategy to prepare for INICET and NEET PG. Go watch it now, guys.